I'll be ready then.
Okay, so you're now recording.
How do I know I'm recording?
Because there's a little button, you see the little red button on the green tab there?
Oh, yes.
This little red button that's flashing. So that'll tell you that you're
that
recording.
means we're recording.
Yes.
Ladies, right?
Okay, so being serious now.
So you will have to control the slides either with the keyboard. So you'll actually need to probably click in first to be able to control the slides. You'll need to click into the presentation before you can use these arrows.
Oh, that's
Otherwise you're good.
So you're ready. Okay, are we ready? Okay, so obviously colleagues from Devon will join, I'm sure, shortly. But anyway, welcome everybody to our 5th and final webinar.
Yay!
Well, we're cheering with all still here. Hey. You never know, we might surprise you, we've got another one to come.
There was a yay in that we've done very well, I think.
Yeah, okay. Probably useful, I know we always do this, but I think it's really helpful just to do a quick round of introductions. So can I talk to 2 people on screen? So Karen first. Well, we've got 2 Karens, haven't we?
Which Karen do you want?
You, please. You started.
I'm Karen. And I work at Martlet's Hospice in Brighton.
Okay, brilliant. And
Karen number 2.
Karen number 2.
Do you want me to say? I know I'm Chris actually, but it doesn't matter.
Why have you got Karen on the screen?
Oh, sorry.
Oh, it looks like Karen. No. I'm sorry, Chris. I apologise.
I know that's right. I'm here for Ruth. Me and Ruth have done all turn at once, I think.
Yeah, I'm obviously having a very funny 5 minutes. So I apologise.
I've had a bit of a funny time in the office actually. Everyone's been popping in and out, and anyway.
Okay. Hello, Bev.
Hello, sorry.
You're in the dark.
I am, I'm sorry, I need to move seats, I think.
We've got a lovely shadow of you.
Well, that's better, it's me and Joe.
Hello, Joe.
Hello.
Hi. Okay.
Sorry, we're just sorting our logistics.
It's all right. We've all done that, you see, and we can now watch you do it because we've all just done it without anybody watching. It's all part of learning, isn't it? We're all very jolly today. Okay, here at Hospice House, Heather, do you want to introduce yourself?
Hi, I'm Heather. This might be the first time most of you have actually seen me. Usually I'm hiding in the corner. But I'm the clinical team administrator here, and I'll be supporting Marie and everyone for the meeting.
And a crucial part of our QI project in-house. Hello everybody, it's Marie from Hospice UK. Heather and I together have been participants like yourselves in taking forward Anita and Claire's webinar work, and so hopefully we're on the same journey with you all, which is great. As well as Heather, and this part of our QI work, Heather is overseeing my training today to make sure that you all stay happily engaged and visible and not muted, or muted even, on the webinar. So I welcome feedback on your experience of technology today.
Brilliant. Okay, and Anita?
Hello everyone, it's Anita Hayes. I'm a quality improvement coach working with Claire here at Hospice UK.
Hello, and I'm Claire, and I'm working with you all here at Hospice UK. So can we have the next slide, Marie?
Yes.
They've taken the controls off us. We can't even turn our own slides on now. So the session today is to look at your success and share your success to date, look at sharing the resources and tools for evaluating impact, recap on spread and sustainability, and then I think really crucial, discuss next steps, what will be helpful and where we go next. There we go. Just as part of the overall 5th session, so you can see what we're actually covering around this is celebrating your learning. So it's sharing the exchange with colleagues on the call, but also then looking at how we maintain momentum and look at evaluating impact. Really just to point out, we've always put this up and really thinking around the change, model for change, and the elements we're going to be covering specifically today. And that really is around motivate and mobilise, and then looking at spread and adoption, and also thinking again about measurement, which I think we continue to think about most of the time. So, usually get us talking a lot. We're over to you straight away to say, so it's over to you to say what you've achieved, really think about these sort of questions. How's QI helped? What are you proud of? And what would make it even better? And, you know, sort of just really giving us some informal feedback about where you're at. So who would like to start?
I'll start if you like.
Great, thanks, Chris. I keep calling Karen. Thank you, Chris.
That's quite polite. So what have we achieved so far? So we're looking at we've been working along with a sequence that we've been given to do around discharge planning and each patient having a formalised individual discharge plan when they leave the inpatient unit. It's not to say we don't do it, but we could do it better. So where we've got to, we're nowhere near finished, but we're well on track. So we've appointed a patient flow coordinator who started week before last, and their role is to enable us to get patients discharged appropriately and sort of better informed patients on discharge, if you like, and looking at care options, etc. So they're in place. We've set up, because we're doing it as an always event, we've set up a project team, which has met once and we're meeting again tomorrow. And that project team are doing a baseline audit against the NICE guidance around discharge. And so it gives us a baseline as to where we are, so we can see the areas that we're doing well and then the areas that we need to work on. So that's where we've got. How has QI helped? I think it's given us the confidence a bit to sort of go forward, look at the process, and sort of make it into more of a project than just a sort of it's what we've got to do, if you know what I mean. It's sort of made sense of each of the elements that we've done. What are we proud of? I think what I'm proud of is that I've got 2 people doing an audit that's never done an audit before here in the organisation, and it's a big audit. So they've done terms of reference, they're actually doing the audit, and then they will do the evaluation. What would make it even better? For me, it's felt I feel like we've not quite finished. So I think with change, it's great to keep it going, but for me, it would have been nicer to have had this webinar a little bit further down the line, but that might just be the project that I'm running.
No, that's really helpful, because obviously this is the pilot and it's thinking, you know, do we need more sessions? Do we need more gaps? What is it? So that's what's really helpful, to get feedback from all of you that have taken part in the initial pilot.
And as I say, it might just be we've got a year to do this sequence in, but I would have liked this session probably a couple of months down the line, really, but it's fine because I'm going to learn now about evaluation and what have you, which is vital to any project, really. So yeah, no, it's been useful.
Thank you. Any questions from anyone?
I'll be fascinated to see what your results are from your when you do implement it.
Yeah, no, it's going to be quite interesting. And looking at, as we know, NICE guidance is down to the nth degree. And we're only doing an audit of 6 patients. So we're just looking at, what we've got in place at the moment, what works well. I know the people that are doing it have actually identified some sort of fairly quick wins, stuff which apparently they're going to bring to the meeting tomorrow. So yeah, no, I'm quite excited by it. And to have people, doing audit now that haven't done audit previously, and seeing how it affects patient care. It's not just a case of, there's something to do. It's actually going to affect our patients and families. So that's been really positive.
Yeah. You're tempting us. What are the quick wins? We're dying to know.
They're going to tell me tomorrow. They won't let me know.
Oh, you'll have to let us know. You'll have to email us, because you're tempting us now, so we have to know what they are.
No, they think there are a couple of things that they can put in place. So watch this space. I've got my oversight meeting tomorrow. So.
Okay, brilliant. Thank you very much, Chris.
Thank you.
Who'd like to go next? Go on, Heather.
Well, what we have hopefully achieved is I hope that this particular webinar was a lot easier with a minimum of technical issues, which has been kind of our goal from day one. One of the things that we have done with this is we were building on the issues and the learning that we got from each session. So I remember the first session, we were a good 15 minutes late starting because we couldn't get things running, and you know, we had all sorts of technical issues with this, and that's not working, and first people can't hear, and all these things. So, you know, experiencing those small problems and then figuring out solutions to address them, even though it's a very small part of this. I think the QI methodology and tools have been incredibly useful. We started with some brainstorming, and then we went into process mapping, and then we went into action plans. So I think we're definitely improving. This one we actually got started dead on time with no issues. Woohoo! And I think. Yeah, it's just at this point what I think just would make it better is just the continuing to train everybody, facilitator support, all sorts of things on all the different aspects. So,
okay. I'd like to share. Thank you, Heather. I agree with everything you said. Working on what you were saying, Chris, I felt your energy and your positivity and the newness of the surprises of people actually getting skills. And I think what Heather and I have been looking at. Okay, this is a problem, but because it's got a quality improvement language, it becomes a more positive challenge rather than a problem or a glitch. So I think the language has helped us we're looking for improvement rather than saying we've got a problem here. Let's stay in stuck in a problem. So I just felt your energy. I felt that too in terms of we feel we have actually, and we've got some more plans, we've got some more work to do on this.
Yeah.
So I think that's great, isn't it, when you think you actually are making some real, tangible, incremental, practical changes for everyone's sanity.
Absolutely. And I think, you know, for me, I mean, I'm quite a big auditor. I quite like audit, but to sort of get that out so that people realise it does make a difference to patient care. You know, it's not just about ticking boxes, and you know, and they can be part of it, and they can be part of that change, which for me is nice to see.
And I think, Chris, the whole use of audit, because people tend to sort of separate it all out and say, oh, audit does, and quality improvement can't be bedfellows, but actually they can, because you can really use them well together.
Absolutely.
Yeah. Yeah.
And it is time consuming, you know. I'm not going to take anything. They've put a lot of work into it, because obviously that, you know, when you go through NICE guidance, there's a lot of it, and you know, and it's not an exact science, but it will give us a good baseline.
Brilliant.
Yeah, and I think, I mean, because that sort of baseline is essential, isn't it? Because, you know, then you can then see, you know, what it is that's different. So what you've done and what the outcome is. So often we start off with the solution, we put something in, and we don't have that baseline data. So, you know, it's really, really good to hear that. Yeah.
Okay, who'd like to next? Bev and Joe?
We're just reflecting on it prior to the meeting, and I think what we have found is that this whole process has allowed us to really focus on what we're trying to achieve. And going back to one of the earlier sessions where we were talking about, you know, what is it we're trying to identify with the vision and the goal, we actually had to go back to the drawing board, because actually what we were looking at was so wide, and actually, you know, it was really hard to define for anybody else who was reading it, because I think when you're leading the group, you know what you're trying to achieve, but then when you're trying to share it with the teams, it's much harder. So I think that was a real positive for us. And then I think our project is a really big project, and I don't think we realised how big it was when we started out.
Yes.
As well as looking at the electronic patient care records, which Wendy's working on at the moment, but she's on leave, because we've got one whole room set up, and we're process mapping at the moment, all the different ways that we are all capturing from the 3 different patient care areas, and we're all doing it differently, and what we're trying to do is create one clear system which will then enable us to look at doing a tablet trial out in the community with hospice home and the community team, and then also looking at how we take it further, because we're looking at moving from our current patient care system to a new patient care system. And until we really understand what it is we really do need to capture, we can't know what we're asking of the other providers out there to actually meet the needs of our patients. So it's a really big piece of work. I think when we chose this one, we most didn't realise how big it was going to be.
Yeah.
And I think I agree with everyone there. I think it would be good to have this final session in a couple of months' time, because we would be able to hopefully share more of it. But we found it very exciting. It's made us look at different ways of working with the teams to try and get them to think differently. And it's also enabled us to share some of our findings more openly with the team. So we've actually done a lot of myth busting through work. So I think all of that is what QI has helped us, and what we're proud of what we've achieved so far. But we're just at the start of it, I would say.
Yeah. A very ambitious project, which I think when you first spoke about it and said, well, actually, it is an ambitious project. It isn't something that you're going to be able to deliver in 3 months. But just from what you've been talking about there, that hugely important preparation and planning and visioning and actually articulating your intended outcomes is so key, isn't it?
Absolutely.
So really, you've got incredible foundations now that you set, and actually seeing incrementally how you move forward, I think will be really important. But you've done some fantastic work to really establish that, and I think that's been amazing. And again, a short space of time to really understand all of that from all of this, thinking about electronic care records. Yeah, really, really great.
Fantastic. And Karen.
Yes, hello. So what have I achieved? I think what I have found most useful, because the project that I've been working on with a small team is around the triage process, which I've talked about in prior weeks. And one of the things that I have found beneficial from this process is the different types of tools that you've been giving us and talking around. So, can we try this? Can we try that? Which I found immensely useful, because the world's changed, hasn't it? And I think tools are becoming to the forefront now, that you don't have to just do something just because you fancy doing it. You have a structure with it. And I think the tools help that structure. So that's what I've got from that. The other thing that I just want to add is that this is probably one of the first webinars that I've been involved in, and I think it has been very, very useful, the whole structure of it, the timing of it, and that has helped keep the momentum of a project that sometimes you feel that you're doing a project in isolation. So I think that's important. And what I would do to make it even better around the whole process is, I'm working with a small team on this triage project, is that actually what I should have done is brought them into this webinar at the outset, and we could have had us together working through this whole project. So I think that's what I would have done differently another time, is to bring more people in with me to go through this journey, I suppose, if you want to say anything, a journey. So that's where I'm up to.
Okay, brilliant. Thank you very much. Anybody else got any final comments? But I think all of the projects have been amazing, and I mean, we've learned lots with you as well, because it's sort of thinking, and we've learned alongside you. So I think it's been very interesting for us too. But you're all doing great work.
Can I just say something? Is it Bev? I agree with your group. We were a little bit ambitious about our vision statement to start off with. And in fact, believe it or not, the CCGs are pulling us back a bit. So we're learning. So I don't think we'll be quite as ambitious as we were going to be around, trying to sort of tick every box. It might just be one element that we look at, but that was quite interesting because I didn't think CCG came back quite. I think we got so enthusiastic that that actually we were going above and beyond what they were asking. So yeah, it's been good learning.
Okay, fantastic. Thank you very much for your honesty and feeding back. That's been incredibly helpful. So following, oops, I've gone on too many slides, haven't I? I'm going to go back to the other side of the click.
Yeah, I don't worry, Claire. I mean, I think it comes
on the wrong way now.
No, yeah.
Sorry.
That's okay. No problem.
Okay.
No problem.
Okay.
Okay, so I think what we wanted to bring to today's discussion was to think about sustainability and evaluating the impact of improvement. And again, this was what came up the last time we were together as potentially being useful topic area to focus on today. So we're going to look at sustainability first off, and I think this is the sort of question which, how do we make it stick? Again, how do we get the changes, the improvements we're making to become business as usual, so that actually we continue to see those benefits and that realisation. And I think, again today, acknowledging that often we're very ambitious and it is about that incremental improvement. But actually, when we've spent time exploring something, we've validated it, we've gathered the evidence base, we've gathered the measurements. How do we think about then scaling up our improvement and sustaining it? And what we did circulate with the reminder, Heather, I think for today's session, was the toolkit that's been developed by the Institute for Innovation and Improvement, and also the questionnaire. So what I'd like to do is just share a few slides, and I think we've probably shared these slides before, but just to see if anybody has had an opportunity to complete that questionnaire and really just have some discussion about the different elements of the questionnaire. So I think the next slide really is just making that point about planning for sustainability. And I think planning for sustainability at the outset of a project, as we're thinking about our vision and our goal, is equally important. But particularly at this stage now, thinking about completing that self-assessment. And it may be that you ask different people in the team that you're working with to complete this self-assessment. And it's a really quick, easy questionnaire to complete. And it will identify, those areas where actually it may be that you need to pay more attention to, or to focus on, and thinking then about actually how you might improve that score. Because in terms of sustainability, we know that there are so many factors. Time is always of the essence, and actually, where is it you put your energy? So I think the next slide, Claire, just revisits. And it just talks about the low scores and keep measuring what you know. But we'll have shared this slide before from the toolkit, and it is quite a straightforward model. It talks about the organisation, it talks about processes, and it talks about staff. And I think that with all of the improvements that we're all teams are making, and in fact, Marie, you're having your training today, there is that element of it actually, if what you're doing within the project around Zoom is going to be sustainable, then from a staff perspective, it isn't only going to be about yourself and Heather understanding how to work Zoom, is it, and how to facilitate this in a timely way. So in terms of sustainability and sustaining this improvement, how are we going to make sure that gets transferred? And is that the thing we need to focus on? Thinking about the organisation, again, when we started to scale up our improvement work, have we got the infrastructure? And I think sometimes we see that, don't we? That we might be in a project mentality, but actually really what we need to be thinking about is the longer term and what resources. And some of that we can capture as we're going through our improvement work. We can think about, what are the resource implications? Are we paying attention to that? And I'm guessing, again, with all of the work you're doing around the electronic patient care record, there's going to be an implication in terms of resources, and capturing that as you're testing your changes is important. And I think, from a process perspective, adaptability is quite interesting there for me, because I think, there's always that tendency too that we put in a policy or we put in a change and we think, right, that's it, we've done that. But actually it's often about, it is that continuous learning process. and thinking, actually, where do we need to adapt as we move forward? So the sustainability framework is really quite quick to do. The questionnaire, I think the next slide brings us on to the scores. Did anybody pick up the questionnaire and just look at it and score it?
I'm going to do that on the train tomorrow.
Okay, Karen. I mean, that's great, because I think, again, it's almost a self-reflection process, and I think it's that reflection that, you can think, and you can do it very quickly, but it gives you that perspective of actually, oh yes, we've focused on this, we've developed our theory of change, we know what we're doing in terms of our interventions, we've got our team working, we're busy, delivering this change, but actually, if we're going to be sustainable, what might we also need to consider, and giving that some thought. So I think the next slide will show you the kind of thing that comes out of doing the questionnaire. The idea being you do it as individuals and you bring it together and have that conversation. And I thought this was quite interesting, because the scores, the closer into the middle the scores are, the more you need to pay attention. So the green dots on that right-hand side, which actually link into the credibility of the evidence and adaptability and monitoring. I thought it was interesting in this example that those are the ones that have had least attention, because we know measuring and gathering evidence to support our improvements is often the hardest part. It's often the bit that we struggle most with in terms of, well, actually, how do we know that the changes we make are an improvement? So I think that's probably not atypical when you score the sustainability questionnaire, that you'll get that line up there. And again, I think, use it as a learning process. It's not, none of this is absolute. It's a kind of have a go and see what it tells you. But it is just quite useful. And I think always that reminder around alignment, around, thinking about your communications strategy with stakeholders, who needs to be kept informed, who needs more information, but also thinking then, importantly about benefits, and actually, that green dot at the top there around benefits. Well, how do we really describe benefits? And Chris, you were talking there about the impact for your patients of this discharge implementation and improvement you're making, and that's so important, isn't it, those benefits, and being able to describe those benefits and carry on sharing those, because having that positive feedback loop is very motivating for staff, as we know, to know that actually things are going well, and actually we're making a difference for patients and families, which is obviously what we're all about. So the sustainability toolkit, I think, is really helpful, and Karen, it'd be really good to, I know we don't have another session, but it'd be great to just speak about how we think about that. I think the next, sorry.
Could you talk about adaptability, how you measure that, or what does that refer to?
So adaptability is that thing about actually, if you put in a change, it's never static. And it is that thing about actually, are you having that sort of continuous reflection and learning? And I think often also adaptability is thinking, well, and I suppose maybe an example I would use is the work we, previously I've been involved in around electronic palliative care coordination systems. And actually, you have something which becomes the solution, it's the intervention, but you need to be able to adapt, and it needs to be able to work with and constantly revisiting when new things come up. So I think it's just that thing about, and I suppose it's also part of that horizon scanning about actually just sensing what is the, what are the things that are going to improve what you've already done, so that it's even better. But the toolkit is very straightforward, and it's very, and I think we've sent you the questionnaire. So I think that is quite self-explanatory, the scoring on there, and it's also then just a useful tool, and it doesn't have to take very long to then have that conversation with colleagues in the team and say, well, okay then, so we've got this challenge here with the credibility of the evidence, because the credibility of the evidence in terms of thinking about commissioning and sustainability is key, because actually if we aren't able to evidence the improvements, whether it's qualitative, quantitative evidence, then actually, it may well be that we don't then actually have the infrastructure to scale up or roll out our work, because we're not providing that.
Yeah.
Does that make sense?
Yeah, but I think if you think about some of the work that you're doing, like your triage and also discharge, is actually thinking, so what evidence, who are you trying to influence with your evidence? And looking at how's that collected, and is it you collect a lot of stuff, but is it useful? So it's that evidence and how you feed it through. So I think that's really important, and that will change. And that links to adaptability, because actually what some people want, if you're saying your CCG, this year they might want one thing around your discharge planning. Next year they might want something else. So you know that's how things can adapt.
Yeah.
And looking at the evidence.
Yeah, and I think the other thing with the sustainability toolkit as well is it sort of reinforces the principles in the quality improvement model. And so again, you know, that changes over time, but it's also important to track over time.
Yes.
And I think that, you know, that's what this highlights really, isn't it? So I think the next slide really is just saying, yes, you know, proactively plan for sustainability. So, yeah, lots of tools and resources. The measurement toolkit. Now, I think we have shared the link to the measurement toolkit, but we'll make sure we definitely send that again, and also the sort of checklist, which is helpful. And I think that point about measuring over time, because it's about a meaningful picture of the difference. So and I think keep in touch, and the keep in touch we'll come back to at the end. So I think it moves on now. The next slide, we start talking. So here are just a couple of resources. This paper, you know, if you have got a bit of time, it's not hugely long, but what this talks about, this white paper from the Institute, is it talks about the relationship between planning your quality improvement, implementing quality improvement, monitoring quality improvement, and sustaining. And it kind of puts that into a perspective and relates it so that it's sort of meaningful. And I think it's really useful. It's also really useful in terms of thinking about what other, I suppose, the connections are within the organisation in terms of what sometimes can happen in a silo. So, you know, we might have part of the organisation planning and part of the organisation monitoring, but it's, you know, how does it relate, and actually are we getting the feedback loop for sustainability? So it's really useful. And I think the next slide just actually has the toolkit again, which we've sent you the link for, so you should have that, and that has got the questionnaire in there.
You can use it all online.
You can use it all online, and actually I hope we've sent you the Excel version of the questionnaire. If we haven't, we can do, because what it does is it automatically does your scoring.
Yeah, that's what I'm saying. Yeah.
So we'll check that we've sent you that version, because it will automatically add up your scores, which is just another time-saving thing, really.
Yeah.
You did. You sent the Excel version.
Oh, good.
Good.
I
hope so. You never know, because we've got so many different versions of different things, and sometimes but that's great, because I think it's anything that makes life easy and quick, so you can think, oh yes, what can I do with the results?
Yes. Okay, so I think the next slide then, we thought we would pause on sustainability and to ask that question if anybody had done the questionnaire or got any questions around sustainability, or experience, you know, how with other projects, you know, that you've been involved in, they either have sustained those changes or they've dropped off.
And that's an interesting one, because we, I think I told you at the previous one, we did a large project about our electronic patient record, just updating it and bringing, because it got so huge, we brought it all back down again and redesigned it and so forth. And the sustainability is a really interesting one around this, because it worked extremely well. People engaged with it. It went brilliantly. Sustainability, because one of the issues, and it's probably the same in every other hospice, is people's default is definitely paperwork. And if they can do something on paper, they'll forget about the electronic patient record. And it's the sustainability of trying to prevent paperwork coming back into the system that is very difficult.
Yeah.
Very, very difficult, Karen. And isn't it interesting, because there's a lot of focus at the moment, isn't there, about the impact of digital technology on our systems, and what impact that's going to have on our workforce and the sort of skills and, you know, how we work as teams. And again, just thinking about the electronic palliative care coordination systems, similar sort of idea. You know, that was interesting, very interesting in terms of learning, because, you know, what it did in the early days, and I'm sure it's still the case in some areas, is it almost it reduced the effectiveness of team working. It was there with a purpose to improve team working by making information accessible and more readily available. But actually it didn't, because what happened was people were not talking to each other. So there was a whole cultural aspect of implementing that change that meant that actually, if it was going to be sustained, we had to address the cultural aspect, you know, and really think purposefully about that in terms of enabling teams to work effectively with the change system, the different dynamics. So I think you're absolutely right. I think it's the learning from some of these projects that then when you kind of come to do something the second time around, you think, well, how would that work next time or in a different situation? Yeah.
I just think, Karen, too, the question that we were asked in a previous meeting about QI is that what's the point of it? Because is the end point to have EPR? Is the end point to have good experience of care? So I often think in terms of why clinicians go back to pragmatic practices is because the intervention may not meet the end point, which is good care, or it could be that they don't like the system. So I don't think it's, I think it's very important that we don't kind of get the intervention to be the kind of the main North Star. It's about, is this giving us our end point? And in terms of sustainability, I was just thinking in terms of a day-to-day basis, how in a clinical area or in a work area, depending who you're working with on that day, your practice will change. In one area, the matron likes the door of the sluice closed. But when she's not around, that door is always open. But I said, watch out, so-and-so is on duty. And everybody shuts the door then. You know, it's this kind of sustainability at what level and the rationale for it. And clearly we haven't bought into, the clinicians start, well, what's the bloody point of shutting the sluice door? You know, it's that kind of thing about sustainability, isn't it? For what purpose?
For what purpose? Yeah. And actually, it's such I think it's not just, as you say, is it, Marie, the intervention, it's actually the cultural aspects, it's the behaviours, isn't it? The end point, as you say. So,
and I think your particular point about paper creeping back in, I'm just thinking, Bev and Joe, this is probably something that you probably need to give some thought, sort of thinking about, because, the default, people are stressed, or people are sort of thinking they're not around, I'll get my bit of paper out that I love.
And I think our challenges have been slightly different in the fact that I think we've seen that electronic patient care systems are working really well and a really good way of cross-cover. And I think our biggest challenge, whether it's from the ward or hospice home or community, is not about the records itself, it's about how much detail is captured. So if it's within one team, it's easier because you can have those conversations as well. But if another team becomes involved, if somebody's written reams and reams, what are the pertinent points that other service needs to know to take forward? And I think we're doing a lot of work and research around the tablets and about what we're going to look to trial. And we've very much looked at what Manchester has done. And I think one of the key findings for us is about the members of staff having those tablets for a month or two before we actually go live, so that it becomes part of their everyday practice, because it is more about culture. Because I think when we do go live with whatever system we're going with, we're taking away paper diaries, we're taking away we have to, because otherwise everyone will go back to what their comfort zone is. Whereas what we need them to do is, if we're going to invest so heavily, is take away that, but by supporting.
Well, test it, Joe. Test it first.
Well, I'm just smiling because I was in a meeting with someone today and I just said, I just can't give my notebook up. And she brought her iPad out. She said, Claire, you just need to have it taken off you. And then you need to get on and you'll have to do your iPad. And I thought, oh, God, and the fear factor. But actually, that is the only way that I'm going to break the habit of using bits of paper.
Yeah. And that's what we found with talking to the child in Manchester, but also more local hospices. It is more fear because it's electronic gadgetry. And actually, you know, if they've given it and actually said, right, go and take it home, go and look at it, see how it works, before we say, right, this is the new system, and as of this date, this is it. You know, and if we're trying to do by 2020 becoming a paperless system in society, we're going to have to actually push it more forward, because we're also looking with our HR system, you know, that people are going to have to book their annual leave, they're going to have to, everything's going to go electronic. Now that means an awful lot of training for people, you know, you know, depending on the level of skills, you know, it's about putting systems in place for people who actually don't know how to switch on computers, don't know how to get the @ sign on, because that means 2 fingers to get @ to actually show. And for some people that's too much. So it's about putting in and actually saying, you know, we've got to create a culture where we're supporting people and giving them the skills. And that's a big piece of work we're trying to undertake at the moment.
Yeah, and that's ongoing, isn't it? I mean, I can see Karen smiling, and I think that's something that is ongoing and, you know, way down the sort of end of the project in inverted commas phase. It's that continual not underestimating about the training, and definitely.
That's what
I think that was one.
Go on, Chris.
Because if we don't get that right and come up with a system that we want all of the teams to follow easily, very quickly, everyone will go back to how we prefer to work rather than the way we need them to work in the future.
Yeah. Chris, you want to come in?
I just wanted to, so our experience of sort of going paper light on the inpatient unit, so having all patient records recorded on a system, the actual change at the time, I think went remarkably well, but our learning from that is how de-skilling it is for bank nurses and agency nurses, if we've had to use them, and new staff, in the fact that they can provide the care, but they can't record anything until they've actually really got familiar with what is quite a complex system. And it's something that, you know, we're now picking up on. But you know, for new starters, it's a massive, you know, because you're moving to a new place, you're moving to a hospice from an acute trust where you know what you're doing, and you're absolutely, and then we're having nurses here that are, you know, they can do all the care, but they can't actually record anything. And I think that was something that we completely overmissed. You know, we just didn't clock when we were, you know, we implemented it and it was fantastic and all the staff were on board and we changed all their, you know, but what we forgot was, you know, for new starters, how debilitating it is if you cannot access that system.
And I think that's a classic, that's a really great example of it's ongoing, you know, there's always something that you've got to be doing, and that's where QI fits in, because, you know, you're always reviewing, oh gosh, yes, you know, learning. So that's fantastic. Thank you for sharing. That's really, So that's your next challenge then.
Oh, don't. We're in the process of it. No, the staff have been fab, actually. You know, we've got some champions and they're working with them. But we just did not get the impact it was going to have on new starters.
No. Great, thank you. Do you want to go to the next bit?
Yes, absolutely. But just also thinking about the disruptive change of technology, actually, and how it just has such a massive impact on us, doesn't it, in lots of different ways that we can't always even predict. I think that's interesting. I was reading something just this week about the sort of robotics and artificial intelligence impact on health and care, and just thinking about that, you know, when actually you've got people with wearable IT that kind of monitors, and it's not that far in the future. And I think thinking, well, you know, our Fitbits, we probably, lots of us have our Fitbits. But, you know, I think thinking about the impact of technology, you know, there's the aspect of electronic palliative, you know, electronic records, which I think we're talking about, and sort of staff, but there's also the impact of technology that's going to, you know, impact our patients and families around how we work and how that's going to affect. So there's quite a lot for the future there, isn't there? Huge. Yeah.
Can I just bring something in there? Because I've just had a situation where I was in Turkey, my husband was very unwell, and actually the way their health, I was actually WhatsApping the doctor. It was phenomenal. It was just, I felt really in control. Do you know what I mean?
Yes.
And you got these instant responses, and it was just a bit of a light bulb moment for me, really. I'm thinking, gosh, you know, it doesn't cost you anything. It's instant, you know, and it worked really well. And
it put you in control as opposed to a professional being, that's fantastic. Sort of nicely brings us on to evaluation, and so a couple of resources here. This Health Foundation resource is in the same series as the communication toolkit we looked at last time. If you contact the Health Foundation, I think you can go onto their website, you can order these freely, don't have to pay for them. Nice little tiny booklets, they're very useful resources. And then the second resource is from the Sustainable Improvement team, which we'll come on to, and that is also, but certainly the framework is accessible. I'm going to share the framework with you. And I'm kind of bringing these two approaches today because there's obviously quite a fast pace working around evaluation, around quality improvement at the moment, isn't there, Claire? There's lots of different thinking around it. Because again, you know, how do we ensure that we've got something that is responsive and working in a quality improvement environment? But this Health Foundation resource is very good. It's very systematic. It's looking at the different definitions. It's looking at the different approaches, and it's also giving you quite neatly those considerations for evaluation. So I think the next, that's just sort of definitions there. But also this fact of actually no firm rules about which approach, because it depends on lots of factors. I think importantly, you know, it's like sustainability. It's one of those things that we should think about at the beginning of programs, and we might draw on some of our reflections of the Building on the Best program, which we have just had a very an external evaluation report. We commissioned an external evaluation, but it was a very interesting piece of work because it was a very mixed methodology, and it was a framework which looked at different aspects of the overall programme, and therefore gave us really a quite a holistic picture of the learning and of the recommendations. But, you know, how long have you got to carry out your evaluation? What's your budget? I mean, all these sort of questions really at the outset of a project as we know, are very useful. So talks about approach. And then I think the next slide, just before the impact framework, comes on to looking at approaches. Sorry, we'll just go back one there. But again, it's really difficult to say, well, actually, you must do this, because I think, again, it depends on the nature of what it is, and really also the purpose of the evaluation. You know, who's the audience for your evaluation? You know, is it actually your commissioners that are looking at this and wanting to look at sort of the benefits in terms of economic benefits? You know, is it actually an improvement team that wants to know very much about, is that intervention working? So I think, again, that's important. But this little guide talks nicely through, you know, these different approaches. So actually, is it summative? Are we going to sum up at the end our learning from this and evaluate? Is it more about formative and informing and shaping an intervention? And actually, Claire, I'm just thinking about the evaluation you commissioned for the community development work at the moment. That's it's both and, isn't it? Because actually it's quite formative. It's going to inform you as you're going along.
Oh, it is, yeah.
And it's shaping.
Yes.
So that again, it's much more dynamic.
Yeah.
But we will have that final report as well, where it will sum up your learning throughout.
Yeah, and we've developed it along with the teams, the sites that are doing the work.
Yeah.
So it's all integrated and working together.
Yeah, and I think that's really important, isn't it, as well? You know, and I think the recommendation is that if you've actually got people involved in that evaluation that you're working with, then it's much more likely to be much more productive.
Yeah.
The difference there between that sort of rapid cycle and the technical bit there, the developmental bit, is just really, it's just, again, it is as it kind of says, it's just the speed. But the developmental bit for me, I think, is where, from a quality improvement perspective, it's, if you've got an intervention where, you've got that evidence base and you are just putting in a single intervention and, you're going to evaluate that, I think that's fine. But if you're looking at something that's much more emergent, much more developmental, as Building on the Best was, then we actually had a much more experimental framework for the evaluation, in a way. But that was interesting because for the commissioners, they wanted to know, well, you tell us your headline process measures. Have you made the difference? We actually had those measures at that very high level across the programme. It was virtually impossible to get any aggregated data because everybody was doing something different. So again, from an evaluation perspective, I think that informs the design you take. So there's something about, actually what it is, what the design of it is, what the purpose of it is, and then your evaluation obviously having to, it needs to align and match to what it is you're trying to evaluate. So
I think it might be useful to share the evaluation. So it was a hospital improvement programme.
Yeah.
And you could share the executive summary, which may be very interesting for you to see some of the things that came out around the evaluation.
Yeah, absolutely. And I think, again, from an improvement perspective, what's interesting about the work we did with Building on the Best is we were kind of straddling the two in a way, because we were thinking about impact. And this concept is from the Sustainable Improvement team in NHS England that talk much more about the impact story. So they talk much more about the narrative. They're talking about data, but they're talking about narrative. So, thinking about all the work you've talked about today in terms of saying, well, what have we achieved? And going back to your initial problem you were trying to solve, you've almost got that story and that narrative, and actually just keeping a diary and capturing some of that narrative throughout the project will help you then to evaluate at the end, because this talks about those three processes in the middle, and it talks about this theory of change. Well, remember we talked about driver diagrams. We said, well, if this is your goal, your long-term goal, what are the things that will impact on you getting there? And, you talked about actually, well, it's the culture, we might need to change processes. Okay, then, so what are we going to do? We're going to test these different things. So we're going to think about time. Yes. Sorry, I've lost my train of thought now. But that's key, because actually having that theory of change allows you to develop your narrative and your impact story. And the important thing just on this slide is to differentiate between contribution and attribution. Because again, when we're making our changes and improvement, it's not normally just one of us or one team. There's often lots of things happening in parallel in the system that will, that will impact. And if I think about the work we're doing in hospitals, there's not only our end-of-life care hospital improvement programme, but, there's an emergency flow programme. There's a programme looking at all sorts of things, access to deteriorating patients. And so being clear about actually what difference we're making, it's often about how we're contributing to that. We're not doing a randomised control trial, so we're evaluating our contribution. And the other thing about this framework is the most significant change, because again, actually, when you reflect about your work, say, for example, with the electronic patient record, what's the most significant change that you've made? Because you're making lots and lots of changes. And then this impact story, which you're structuring around your theory of change, and then you are using your evidence, your amalgamated evidence, to kind of tell that story and your narrative. And I think we we used that approach, didn't we? We're building on the best as well. We drew on lots of different things. And then those are just those underpinning principles about that framework, and they are on the website as well. And I think I like that there about, judgments of value can and should be made by those involved and not only by objective third-party evaluators. So it's really key we all get involved in the learning, because often it's the focus on the learning, not just actually and I think that's great you're saying about we're not just ticking a box here. Actually, it's the journey and the learning that's as important. So Claire, sorry, I've
No. I think we've got this one.
Oh yes, we've got one more, practical considerations. Yes, we'll never forget the practical considerations. But yeah, obtaining ethical approval. I mean, we've come across that in some of our evaluations, and as I'm sure you have done, always need to allow time for that. Collecting and analysing data, again, thinking about data in terms of the sort of data. You talked about the audit data, and you talked about actually doing a fairly small sample size of 6 patients. So again, it's just thinking at the outset, what kind of data, doing the paperwork, and then building that culture of learning. We skipped over the paperwork, but
we do e-paperwork.
We do e-paperwork, and the culture of learning. So I think both of those frameworks have got lots of top tips and lots of value, but hopefully useful just to consider briefly.
Yep. So any questions? Did that make sense?
I talked double Dutch.
There's a lot in there. Yes, really good.
Yeah, sorry.
Probably want to actually sort of think about it.
Yeah, it has a lot of information. It's good. But it's good information.
So it's just time to reflect.
I think I need a bit of time to absorb all that and revisit some of the prior sessions, but it does make sense. And again, I just go back to, it's really good to recap that there is a process and we can draw in different tools to do this. And at the end of the day, it all just helps move systems, processes, etc. if there's an improvement.
Right.
Yeah, and I think the rationale with us always having the change model at the beginning is because actually everything we've been talking about over the sort of series links into that change model, and so it's quite a useful aid memoir, isn't it? Because there is a lot, isn't there? And,
there is.
And I think the thing is, none of it has to be perfect. It's not about perfection. It is about just, is that having a go with some of this, isn't it? And moving it forward and being mindful of that, really.
So we're obviously sending you out all the resources, and now we're sort of like at next step. So that's why I wanted you to feedback the sort of things that you'd found useful or what would be helpful next. So I think we've got some ideas. I know I raised the issue that our colleagues at the Academic Health Science Network may be wanting to do a session. She hasn't been able to come back to me because she's been on holiday. So that could be another opportunity to look at how you develop a good project team, because I know that's something that you were thinking about that would be very useful. I think also from our perspective, I would be very keen to hear how your projects move on or what would be useful, and I think it's thinking how that would help. But also from yourselves, is it helpful to even sort of think about having another session in a couple of months' time, or think about other things that would be useful for you? It's really open to you, because this is a pilot. So I don't know what your thoughts are.
I think coming back in a couple of months' time, for me, I know the others have got, especially the electronic patient records, that's a far bigger project. But I think for me, in a couple of months' time, I should be able to see, I should be measuring the outcomes by then and seeing if there's been any improvement or not. And it'd be quite good to celebrate.
Yeah. Chris, what were your thoughts?
My thoughts are similar, really. I just think, a couple of months' time and just sort of catch up and see where we're at. And it keeps us going. Do you know what I mean? It keeps us driving things along. And for me, it's just nice to have a forum that's been talking around quality stuff. Because there's not, perhaps it's me, but there's not masses of resource around about quality. And the difference it makes. So for me, it's been really useful, and I would like to meet up again in a couple of months' time if that's possible.
Okay. Bev, Joe, what are your thoughts?
Yeah, I think we need to agree, because I think, you know, although we won't have completed, hopefully we'll meet some of the milestones we set ourselves.
Okay. Yeah, so, and Heather and Marie, what do you think?
Yeah, I agree. We'll have it all completely.
I think
we'll be in charge of it next time.
we'll
be in charge of it next time. Yeah.
I think maybe scheduling one last or a last webinar just to catch up with everyone and see where you all are and how you've used any of this and any questions that may have come up. I think would be very helpful for the group. So
That's great. So what we'll do is okay, so the agreement is that we'll get together again in 2 months' time. We'll send some dates, we'll send dates out to you. The other thing is that we'll send all the resources. When my colleague comes back from the Academic Health Science Network, I'll see what her offer is and put that out to you. We will send you a questionnaire because it'd be really useful to get feedback, because we really want to know what we could do better. And also the $1 million question, would you recommend it to other people? Oh, I'm not sure. They're all going quiet.
Answer.
So, I mean, you know, and I think we want to make sure it's right to sort of help. So if you think it would be useful for other colleagues, then let us know, or if you think it, you know, sort of thing. But, you know, we want to make sure it's right for you so that you're getting what you need out of it. Like
I said previously, I think I would have liked to have had a few more with me on this.
Yeah.
Because, you know, it's better to have more people, more brains looking at it and reflecting on it. So I would recommend it to others. Absolutely. I think it's been a really good piece of work that you've pulled together.
Great. That's brilliant. You can always go through it again if we do it again, Karen, with your team.
Yes, but I think there's something about interacting with you.
Yeah.
You're both very knowledgeable, and also interacting with other hospices, I think, has been really good.
Okay, fantastic. Thank you. Chris, Bev, Joe, anything else to add besides that?
I agree with the fact that it would, you know, obviously Ruth and myself, we're trying to do it between us, but
yes.
It would have been nice for us to have actually done one together, or another. And in hindsight, it would have been nice for me to have brought perhaps the two people that are doing audit along, you know, just to get them part of something and see how it all fits in, and you know, and what's going on really. So yeah, I would definitely recommend it, but I think it would be nice to do it in a little group.
So, I mean, I'm just thinking how we could sort of share it with other members is actually say you need to do it as part of a team. The value is actually having a team. Colin, Bev and Joe, you've actually been doing it as a team, haven't you?
Yes, but the group has grown when we first started. So I think, and unfortunately the project lead's not here today, you know, with league and everything. I think for us, most probably, the realisation, because you are a group, that you actually need to put dedicated time aside in between each session to actually spend time together. I think that's the challenge of being a group. So I think to roll it out and say, because I think it is better when there's a group of you, because you bounce ideas off each other. I don't think we realise how much time we should have put aside in between each one, and because of our diaries. And I think to do it again, I think that'd be quite good to get across at the beginning, so that people are signed up for not just these sessions, but to dedicate time in between.
Yeah, definitely.
Okay, that's really helpful because we can do it. Marie, Heather?
No, nothing from me.
Okay, all right. Well, brilliant. What I'd like to say is thank you very much for your contributions. It's been great, and we really, really look forward to regrouping in 2 months' time. So thank you, everybody. Thank you very much.
Thank you.
Thank you.
Bye.
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 Happy holiday, Claire.
Bye. Thank you. Enjoy the trip. Enjoy the Isle of Wight.
As long as it's not too choppy.
Not too choppy. Don't want it too choppy. No. Bye.
Bye-bye. Bye.
I'm going to click a meeting.
Do you stop recording first?
So you hit end meeting.
Yeah.
It's too much.